Hello, everybody, and welcome to NYC Health and Hospital Kings County's YouTube podcast. My name is Andrew Eberlein. I'm one of the surgical PAs here at Kings County, and today we are joined by two other surgical PAs. We have Suzanne Forde and Michelle Ling. You guys want to introduce yourselves?
Hi, I'm Suzanne Forde, Surgical Physician Assistant and Quality Leader for the Department of General Surgery.
Hi, I'm Michelle Ling. I'm one of the plastic surgery physician assistants here at Kings County Hospital.
Our focus for today will be the impact of PAs on healthcare, more specifically the role of the surgical PA within the healthcare team. I figured that would be fitting as the three of us are all surgical PAs here at Kings County. The first topic I thought we could discuss today is how PAs here at Kings County help to improve access to care for our patients here within Brooklyn.
So firstly, physician assistants have become extremely important in the healthcare system. PAs are highly skilled medical practitioners with master's degree, and we are accredited from very highly skilled programs. And as physician assistants, we work strongly alongside with surgical attendings. Many of the things that we do with regards to working with people in the system is that we do physical examinations. We are able to autonomously diagnose and treat and interpret. We are also able to perform surgical procedures with our attending where we are considered first assist. We also work in nursing home facilities and private care facilities, and especially in a hospital setting, because we are very cost effective, a lot of us tend to be hired within the hospital environment so that we can service more patients.
Awesome, I agree. And Michelle, do you have anything to say about that? Talk to us a little bit about your role in the plastic surgery team here at Kings County and how you're able to help improve access to care for those patients.
So in my department, I see patients all the way from the initial consultation, the preoperative visit, making sure that patients are optimized for surgery, and even first assisting in the surgery and seeing them afterwards. And we follow up with the patients up to a year out just to make sure that everything is going well with the patient. And a lot of times, we also establish closed loop communication within the team because we collaborate with different physicians, nurses, and PCAs. And a lot of times, the patients actually have access to contact us on our work devices. And this way, if there's any issues, the patients can contact us and we're the first line for them.
One of the things I'd like to add to what Michelle said is that PAs come with a level of compassion and dedication towards serving the people in the community. We are very compassionate, we're strong, we're driven, and our responsibility is to provide the best high quality care under the supervision of a physician, but also on behalf of the institution that we work for.
Exactly. And we are trained from that team-based approach when it comes to practicing medicine, which is great. Even myself within the Bariatric Surgery department, we have a great team of providers there. And just in terms of a numbers game, right? It's helpful to have additional providers who are, like you said, Suzanne, highly skilled and well-trained to help be there to see patients, because as we know, we see a very diverse, very large population of patients here at Kings County, and having more providers in clinic who are able to provide that care helps us treat and evaluate and help more patients every single day within the clinics, within the inpatient settings that we all work, within the operating room like Michelle had touched on. Another topic I thought we could discuss is our impact as PAs within the surgical team, especially considering that all of us work in the surgical department. And as we know from the AAPA website, about a quarter of PAs that practice within the United States work within the surgery realm, within surgical teams, surgical subspecialties. So Suzanne, how would you say that a surgical PA has helped you on the team to impact patients and guide their care throughout the general surgery department?
One of my biggest responsibilities as a surgical PA is, especially when it comes to patients who are having surgery, I'm one of the persons they initially see. And I'm also one of the persons that's responsible for scheduling their surgical procedures and making sure they get the pre-surgical testings done, make sure they get whatever necessary imaging done or whatever is needed for them to get from the surgery to being discharged and being at home. I'm also responsible too for making sure that even after the surgical procedure, the patient is attended to by receiving multiple phone calls to make sure that they're okay post-surgical wise, and also to have that follow-up appointment. In a nutshell, as PAs in my service, we're responsible for them from the initial point in which they show up in clinic all the way to recovery, and subsequently under surgical services, we follow them for 5 years.
And it must be nice, I'm sure, as a patient to see the same providers when they come to clinic for not only their pre-op appointment, but their post-op appointment.
Yes, and that's very true. As a matter of fact, they feel very comfortable, especially the population we serve, in order to be able to express themselves how they feel, what's going on with themselves during the whole process of surgery, especially the type of patients that I deal with, which many of them are cancer patients. They appreciate that lifeline that they see and feel from the PAs as we help them, not just from a medical point of view, but from a support point of view, from the beginning of being diagnosed all the way to recovery and treatment.
Yeah, and you work within more than one subspecialty of general surgery, isn't that correct?
Actually, I do, yes. I work in, general surgery. I also work in vascular surgery. I work in colorectal surgery and surgical oncology surgery.
So a ton of experience and a ton of ways that you can help your patients, not only within one clinic, but spanning across multiple clinics here at Kings County. And Michelle, you work in the plastic surgery team as well, right? So why don't you tell us a little bit about how your role, along with the other providers on the plastic surgery team, help to improve access?
Of course, Andrew. So similar to Suzanne, I also, see patients all the way from the beginning to the end. And a lot of times patients come in just wanting an answer to figure out what's going on and how we can help. And a lot of times, we are there to support them, but also let them know what needs to be done to get them optimized and ready for surgery. And I really work close in hand with the bariatrics team, which Andrew's a part of, and also breast surgery team, because working in plastic surgery, a lot of times when patients undergo bariatric surgery, they have a ton of weight loss, and it leads to having a lot of excess skin in a majority of their body. And a lot of times it affects them not only physically, but also emotionally and mentally. And in those cases, we're able to provide, surgical excision of that, and it really increases their quality of life. And from the breast cancer standpoint, a lot of patients, when they undergo removal of their breast, a lot of times they feel like they're not themselves once the breast is removed. So a lot of times we see them and we undergo breast reconstruction, and it really impacts them positively.
So Andrew works for bariatric surgery, and they have been with Kings County for a couple of years now, and now they're fully established into an accredited service.
Yeah, so we actually just went through a recertification phase. So we are now recertified as a Center of Excellence in Metabolic and Bariatric Surgery here at Kings County. It's been really great. We have a great team. Myself, our nurse practitioner, our 2 surgeons. We work really hard to help see as many patients as we can and perform our services here at Kings County. One of the ways that I will say PAs have a great impact within the surgical team, I can say from experience, is just like Michelle and Suzanne have touched on, following up with patients and being a part of their care perioperatively. So pre-op, intra-op, and post-op. Myself and Michelle actually also first assist in the operating room. And one thing that I always say is the greatest thing to hear as a PA is when you're seeing a patient pre-op and one of their last questions before the visit is over is, will you be there? And I'm able to say to the patient, yes, I will be. I'll be assisting Dr. Morin or Dr. Huang during the procedure. And just kind of seeing that little smile or that light in their face, knowing that somebody that they've had care with before is going to be another familiar face on the day of surgery, just to make them feel more comfortable, to make their care feel more routine and to feel safer, I think is a great thing. What would you say about that, Michelle?
Yeah, no, I agree, Andrew. The patients also ask me the same thing, and it really does make me smile because I realize how much of an impact we as PAs make on the patients. And a lot of times after the surgery, they come to us and they're so happy with the results that we're able to help treat something that they didn't think was possible.
One of the gems that was created under the Department of General Surgery was an area called elective procedures. We call it E4 procedures. And this gem was created post the COVID pandemic. Many patients who needed surgeries that were elective were kept on the back burner because it was a slow process and reopening our services. So a couple of years ago, we created a spot in our E-building, fourth floor, on Fridays where we can do small elective procedures, where we can move things like lipomas and masses and skin grafts and things like that. Now it has expanded to plastic surgery services and to other general surgery services. The reason why this is significant because many of the patients who have small procedures that were waiting to go to the OR, now they can come on a Friday twice a month to have these elective procedures done. They're about an hour long and they could go home and then they can get on with their lives. And Misha would know about this because Misha was also part of the process.
Yeah, definitely, Suzanne. So we had a few patients who would come in and also, like she said, do earlobe repairs. We would remove lipomas or cysts, something like small, usually on the face. And a lot of times, if you bring them to the operating room, it's a very long process. And a lot of times they're required to go under some sort of anesthesia, which impacts care. And in the cases where we're able to do it in the clinic, patients are able to come in and out in a timely manner and usually go back to work the next day. And this is really important because a lot of times we don't want to keep the patients waiting a long time to get these small procedures done.
And there's just one thing I must add. The process was created by a PA.
And Suzanne, you have a pretty big role in coordinating a lot of those E4 procedures, correct? You work with a lot of the general surgeons and help to coordinate their E4 procedure days?
Yes, I do.
Very nice. Okay, so far we've touched on a lot of the different ways that PAs are integrated into the healthcare team within the clinical setting, within the peri-op care, preoperatively, intra-op, post-op, and even the E4 procedures like you both take part in. But what are some other ways that PAs help to impact patients' care outside of a clinical setting, maybe administrative, maybe socially?
Yeah, so usually in a plastic surgery setting, we not only collaborate with the clinical team, we also are always in communication with the administrative team, such as the staff, the front desk staff, and also the operating room navigator. A lot of times we keep in touch with them on a day-to-day basis to make sure that the patients are getting their appointments, making sure that all of their labs are done, and that the patients are cleared for surgery, not only medically, but also from the insurance standpoint.
Yeah, so working in elective surgery, like you were kind of touching on, there's a lot more that goes into getting patients to the operating room than just seeing them in the office, answering all of their questions and making sure that they feel safe with the operative team. It's also about, the background, making sure patients are socially ready for surgery, making sure that they are cleared for the procedure from a financial standpoint, cleared from a medical standpoint, and also working with our other members of the team, our surgical navigators, our operating room front desk staff, our operating room nurses, and then our surgeons who are there to provide high quality care for our patients. But we help them in a large aspect and help make sure that they can do their jobs and they can perform these high quality procedures.
Exactly. And we also help them by making sure that everything is ready to go. By the time the surgery comes, we make their lives easier. We also aim to maintain the high quality of care. Prior to surgery, we ensure that the patient has adequate support system at home, since the recovery period after surgery can be anywhere up to 3 to 4 weeks. We also do a lot of data collection and follow-up on all the surgeries and post-op complications to ensure that we can improve our patient care. Can you tell us a little bit more about that, Suzanne?
Yes, thank you, Michelle. So as the quality lead for the Department of General Surgery, one of the things that's most important when a patient comes into our facility, it's getting them to the right place. So we see hundreds of patients every single week. that are referred to each services here, and it's our responsibility to make sure that the patients not only get into the right clinics, but if they are not in the right clinics, they get to go, or we get to redirect them to the right areas. Things that are needed to substantially get them into the system, for example, financial clearances and things like that, or maybe even getting them registered with the financial services here, is also part of the work that we do, so that they can begin taking care of their care and them having not to worry about these things. As a quality leader, it's also my responsibility to make sure things are done properly and things are done correctly. Like, for example, patients who have surgery, I'm also to make sure that after surgery, patients are able to follow up. Patients who need their imaging studies, making sure that they get it on time so that when they come to clinic, they have a valid clinic visit so where we can review their imaging. I'm also responsible for finding out how they feel about coming to our service, what things that we can do to improve their care and also to make their lives better. I'm also too responsible for making sure we are Joint Commission ready and that we follow the procedures and the protocols that are laid out throughout the facility so that we can maintain and keep the standard of care at the excellent level that we have been doing over the years.
That sounds amazing, Suzanne. It sounds like you do a lot for us in this hospital.
And this is why PAs are very important. One of the things that really hones in when it comes to the cost effectiveness of PAs is that we fill the gaps. We are the gap between the physician and the patients that we serve and the community that we serve. We're the faces that they see every day, all the time, to the point where sometimes they actually feel like family to us. And this is very important in a role as a PA. We're not just excellent clinicians that are excellently trained, but we also have a sense of compassion and feeling for the community that we serve.
Yeah, that's a great point, Suzanne, and that even ties into the previous episode where our other PA colleagues talked about the introduction to the PA profession, and they touched on not only our role and our scope, but also on the history of our profession and how PAs kind of arose out of those crucial areas within the healthcare system to help provide high-quality healthcare where needed. All right, so we had a good discussion here talking about the role of PAs within healthcare, the role of the surgical PA, and how we help to improve access to care here at Kings County, how we also have very autonomous roles within the healthcare team, and about our impact that we play in patients' healthcare here at Kings County. And that role here at Kings County continues to grow as we continue to hire more and more PAs and as we continue to fill more and more gaps within healthcare and to help provide more high-quality care to the patients that we serve here in Brooklyn.
And we look forward to taking care of every patient that comes in through the doors.
Thank you all for joining us. Thank you, Michelle. Thank you, Suzanne, for your insights into the life and the role of a PA here at Kings County. And thank you to all of you for listening. And please join us for the next episode.